Hello, my name is Cameron, and this is my critical appraised topic research proposal. It is on burnout in athletic trainers at the collegiate level. For my research introduction, we first need to know a little bit of background and current knowledge. So, burnout is the result of physical, emotional, and mental work-related stress that is prolonged and excessive. It can often lead to triggering physical, mental, and emotional responses that often leave people feeling isolated or defeated. And this can show in negative behaviors like overeating or oversleeping. Common symptoms are fatigue, low energy, headaches, detachment, frustration, hopelessness, helplessness, loss of motivation, and sleep disturbances. Current knowledge shows that common effects of burnout are lower focus, decreased ability to find motivation, and impaired cognitive function. Common causes of burnout are negative work environments, and it can occur from other roles in life that you may play, like parent, caregiver, or a spouse. It's important that we discuss stress versus burnout because stress is often confused with burnout, but it's actually the beginning stages of it. There is a lot of research on the two, and burnout can vary from person to person, just like stress can. To look at the differences between the two, stress signs and symptoms are loss of energy, urgency to complete task, over-engaging in work or task, and physical symptoms like headaches or overreacting emotionally to smaller topics. But when you look at burnout, signs and symptoms, the task is usually not worth your while, or emotions may feel blunt, you may feel undervalued and consistently exhausted, like there's more bad days than good days. Burnout is consistent and repeated for days, and you may be disengaging from work or task. Physical and emotional symptoms are more persistent, and you may react without or less emotion. Burnout is often experienced when there is conflict, overloaded amount of pressure, negative factors, or person characteristics, lack of control, and pushing physical and mental limits when in the workplace environment. So, because it's most often caused by problems at work, it's important to know that quitting is not the only option and there's other ways to deal with it. You can do this by drawing better boundaries like self-care habits and hobbies outside of work and improving work-life balance, but it's understandable that it could be overwhelming or feel impossible at times. But this is also a reason to stick to a routine. For example, not checking emails outside of work. You first need to figure out if you are experiencing burnout, and this starts by being aware of stress, fatigue, sleep patterns, worries, physical signs, and personal behaviors. Some physical signs that may be present are headaches, and some personal behaviors that may be shown are becoming distant with those around you. So you may be asking why self-care is so important, but it's important because self-care tasks can help control burnout as found in research. So some examples of self-care that you can try are more sleep, cardiovascular exercise regularly, and mindful meditation, yoga, mindful breathing, mindful walking, self-compassion, and talking with trusted people around you. When burnout is not experienced by work, it's often caused by stigmas and those putting blame or pressure on themselves in whatever role they hold to others. The purpose of this research is to provide athletic trainers with information on how to manage and prevent burnout, and this starts by understanding the cause and effect of burnout. Many athletic trainers experience burnout, which affects their patients as well. So, understanding the components of burnout for athletic trainers is important to provide better self care for themselves and also good quality health care to their patients. This research will critically appraise research done on athletic trainers at the collegiate level to help close some gaps or discover the patterns that is in current research today. The end goal of this research is to identify the similarities and differences found in athletic trainers experiencing burnout at the collegiate level. To highlight some important research questions this research will also answer is what causes and effects can athletic trainers experiencing burnout have on athletes? What are common findings in athletic trainers at the collegiate level that experience burnout? And what are common strategies used to overcome burnout in athletic trainers at the collegiate level? The value that this research holds to the athletic training profession is that athletic trainers lacking self care and experiencing burnout risk providing lower quality care to their patients. The biggest concern is found in past literature findings that indicate those suffering burnout often display decreased work quality, and because of this, it can indicate decreased quality of patient care. So, there is an urgent need for more information on prevention and management skills for burnout and athletic trainers at the collegiate level. Did you know that athletic trainers are healthcare professionals who can experience burnout, especially after the age of 30? Because after the age of 30, many athletic trainers experience workforce decline, and burnout can be contributing to this issue. Past research shows that burnout can cause headaches, high blood pressure, weight concerns, indigestion, fatigue, and sleeplessness. Athletic trainers' purpose is to provide care to athletes to prevent, recognize, diagnose, treat, and recover from injuries and illnesses. Athletic trainers spend more time with their patients than other healthcare professionals, so they develop rapport with their patients, which is a close relationship that involves an understanding of each other's feelings and communicating them with one another. And the NATA focuses on whole patient care, and burnout can decrease the ability to provide this. For athletic trainers experiencing burnout, it can affect the athlete by increasing the risk of injury, decreasing their performance, and decreasing psychological well being for the athlete. This is due to the athletic trainer's decreased performance. This can be applied to athletic trainers in any setting with minor adjustments. Athletic trainers have to be aware, adapt, and self educate to follow evidence based practice in their athletic training career. This CAT research can be used the same way. This research will give insight on burnout, signs and symptoms, and those that are not in the AT profession can relay this information if they know an athletic trainer. And ATs are subject to burnout with the long hours they put in, physical and emotional demands, heavy caseloads, work-life balance, and pressure from coaches, parents, and administration. Burnout can affect those around the athletic trainer that aren't in the workplace, for example, family and friends, because those experiencing burnout often withdraw from different aspects of their life, which can lead to a reduction in socialization. For my search strategy, I'm going to be accessing databases through the NIU library. Databases that will be used are PubMed, National Library of Medicine, Cochrane Library, and Academic Search Complete. When utilizing the PICO question strategy in my searches, I will also include Boolean phrases. A breakdown of my PICO question is patient, athletic trainers at the collegiate level, intervention, cause and effect of burnout, comparison, management and prevention, outcomes, burnout and athletic trainers at the collegiate level. And to the right, you can see a better detailed diagram that breaks down what could go into population, intervention, comparison, or outcome. Boolean phrases I will be utilizing are athletic trainers and burnout, athletic trainer, burnout, and collegiate level, burnout cause and effect and athletic trainers, burnout management and prevention, and athletic trainers. So to the right, you can see that when you use or, you get either term. When you use and, you get both terms. For my research method, inclusion criteria is athletic trainers at the collegiate level, certified athletic trainers, peer-reviewed articles using evidence-based research, high CASP score to identify the level of quality in the research study. So answering yes in the first 2/3 of the questions can indicate poor quality evidence is being used, and answering no to most questions on the checklist indicate higher quality evidence. The Pedro scale will be used to rapidly identify what controlled trials are valid within the study and will only be used for RCT articles used in the research. So this will give significance of treatment effects and strategies that are worthwhile for the study and the research. Exclusion criteria is research conducted on physical therapists, team doctors, strength and conditioning coaches, or sports psychologists experiencing burnout. After doing my research, a study screening will show a total number of articles that will be provided for each database, and based on the article type, there will be a number of articles used for each appraisal tool, and this will be displayed within a chart to give an explanation for what articles are eligible based on inclusion and exclusion criteria. By using a chart, you will also see the key findings and a summary of the search that will be displayed. A peer will review the title and abstract to assess whether inclusion and exclusion criteria are met in the article, and peer will also review articles for full text availability. So within the full text, they will also examine if the article meets the inclusion and exclusion criteria. So as you can see, these are examples of the summary of search result charts that I will be using. And a display of article selection will be utilizing a literature review matrix that will be used to maintain organization and review of the article selection. Primary research studies will be used in the research, meaning articles will present original research conducted by the authors, and it will be broken down into section as you can see on the screen. For my appraisal tools, the CAPS score will measure the evidence of quality for each article, and these checklists can be found on their website. Research will be given systematic reviews and meta-analysis articles, which are the highest level of evidence. The Pedro scale will be used for RCT articles only, and 11 yes or no questions is what the Pedro scale uses to determine quality measurement of the article. Yes is given a 1, no is given a 0. These tools will produce quantitative results that will be reported using a chart to demonstrate characteristics found within the studies. I have provided the CASP website URL and also the questions that the Pedro scale utilizes. You can see that high quality is 6 to 10, fair quality is 4 to 5, and poor quality is less than 3. I will be extracting data on the athletic trainer's career standing within the study. So this can include, but is not limited to, years of experience, averages, collegiate level, employment status, qualitative findings, and health standings, and also perceived stress. And they will be common across all articles. To synthesize the data, I will evaluate evidence into summaries to help organize and compare the findings. This will be done using a characteristics chart, qualitative and quantitative charts as well. This will lay out the strengths and weaknesses, and the purpose of this is to find meanings in the data extracted from the studies. This is an example of characteristics of included studies, and this is an example of the quantitative results chart, and lastly, the qualitative results chart. The clinical bottom line provides a conclusion of the results relevant to the main research purpose. So it will show the main findings of cause and effect of burnout, prevention and management strategies of burnout, strong recommendations on evidence-based research as to why athletic trainers at the collegiate level experience burnout, what effects burnout can have on themselves and those around the AT, and lastly, strategies found to be effective in treatment and avoiding burnout in athletic trainers at the collegiate level. So this section is going to provide the main needs of the athletic trainer to prevent and manage burnout. In this section, it will state the strength of evidence using internal and external validity of the research. Internal validity is accuracy of the study with minimal bias, and external validity is application to other populations. For example, there would be high internal validity if the cause of burnout had a clear effect on the athletic trainer at the collegiate setting, and there would be external validity if burnout affects several people and is commonly seen in the workplace. Again, the purpose of this research is to provide information to athletic trainers about the cause and effect of burnout and how to prevent and manage it. So this section is going to describe the overall evidence revealed and the similarity to past research. So the implications after research are going to draw a conclusion on how this information on burnout can be used in athletic training practices, education, and future research. So it's putting all of the pieces of the puzzle together. I want to reiterate the importance of practicing self-care as an athletic trainer to provide good quality healthcare to the patients. And this starts by understanding burnout from start to beginning to not only reduce the risk, but to also improve rapport with athletic trainers and the athletes. And this also will advocate for the profession. There is unfortunately expected job stressors because of overlapping seasons, long work hours with limited personnel and financial resource to provide appropriate health care to athletes, emotional demands in work or personal life, and underappreciation for their care that they're giving. But athletic trainers with high levels of interpersonal interaction often are more susceptible to burnout. So, giving the passion and deep care that they have to provide good quality health care can sometimes come at a cost. So, it's important to understand how to improve work-life balance for athletic trainers. Athletic trainers can use this information to prevent and manage burnout based on the common cause and effect information that's also provided but by doing so, we can know that if applied or utilized in their day-to-day lives, that the research has potential to set boundaries for personal health care needs. This information can also be helpful for those entering the profession because they can use the data to prevent themselves from ever experiencing burnout. And this is going to aim to improve student athlete engagement or those entering the athletic training profession. So, this also has potential to improve future generations of athletic trainers and athletes that may receive care from athletic trainers. There are three categories of research implications that this research article will use in relation to burnout. Theoretical implications are a framework for academic and scientific research as it is ever evolving, and each person experiencing burnout will have a varying experience depending on their situation. Practical implications are especially useful for healthcare practice and real world scenarios based on trends found in the conclusions. For future implications, it will guide the new areas that need to be investigated, and knowing limitations will provide a guide on how they need to be addressed going forward for better results and insight. Thank you for following along. These are the AMA citations used within this research proposal presentation.